Hello everyone. In today's session, we'll explore Neosporin, a widely recognized brand name for a combination of antibiotics used topically. As always, this discussion is for educational purposes only. For specific health inquiries or concerns, consulting a medical professional is paramount. Description: Neosporin, known generically as a combination of neomycin, polymyxin B, and bacitracin, is a topical antibiotic ointment designed for external use. It aims to prevent infections in minor cuts, scrapes, and burns by killing bacteria on the skin's surface. Neosporin is available over the counter and is a common item in first aid kits. The combination of antibiotics works synergistically to offer broad-spectrum bacterial coverage, making it an effective preventive measure against infection in minor skin injuries. Warnings: although Neosporin is safe for most people, it's essential to be aware of possible allergic reactions. Signs of an allergic reaction include rash, itching, redness, swelling, or difficulty breathing. If you experience any of these symptoms, discontinue use immediately and seek medical attention. It's also important to note that Neosporin should not be used on deep wounds, animal bites, or serious burns without consulting a healthcare provider. Before using this medicine: before applying Neosporin, clean the affected area with soap and water. It's crucial to inform your healthcare provider if you have a history of allergies to topical antibiotics. Neosporin is intended for external use only, and care should be taken to avoid contact with eyes. In the case of accidental contact, rinse the eyes thoroughly with water. If you are pregnant, planning to become pregnant, or breastfeeding, consult your healthcare provider before using Neosporin. Side effects: while side effects from Neosporin are rare, some individuals may experience minor skin irritation, redness, or itching at the application site. If you notice any severe reactions or signs of an allergic response, such as swelling or difficulty breathing, seek medical attention promptly. Interactions: Neosporin is typically used topically and has minimal interaction with systemic medications. However, it's always advisable to inform your doctor about all medications and supplements you're taking, including over-the-counter products, to avoid potential interactions. Dosage: Neosporin should be applied to the affected area 1 to 3 times daily, or as directed by a healthcare provider. A thin layer is sufficient. After application, you may cover the area with a sterile bandage. Do not use for more than 7 days unless directed by a healthcare provider. If there is no improvement or if the condition worsens, seek medical advice. Avoid: to prevent the risk of infection and promote healing, avoid touching the wound with bare hands after applying Neosporin. Also, avoid using the product extensively over large body areas or for prolonged periods unless directed by a healthcare provider. FAQ: a common question is whether Neosporin can be used on all types of skin injuries. Neosporin is suitable for minor cuts, scrapes, and burns but should not be used on deep wounds, serious burns, or animal bites without medical advice. Concerns about its use in children should be discussed with a healthcare provider, as safety and effectiveness can depend on individual circumstances. Closing: this concludes our discussion on Neosporin. This guide is intended for educational purposes and should not be considered a substitute for professional medical advice. Always consult with a healthcare provider for personal medical questions or concerns. Thank you for joining us.